Hi everyone, I'm Kathleen, student respiratory therapist, and I'm here to talk about Apgar scoring. What is Apgar scoring? Apgar scoring is a standardized assessment of a newborn at birth where it quickly assesses the newborn's severity of depression. Most infants enter extrauterine life with crying and vigorous activity. However, that is not the case for all, for a number of maternal and fetal conditions may result to neonatal depression at birth, in which we will need to intervene too. The APGAR is made up of 5 components. It scores the baby's appearance, pulse, grimace, activity, and respirations, each of which is given a score of 0, 1, or 2, totaling to 10 as the highest possible score and 0 for the lowest. How the scoring system is done is shown at the table. For appearance, the baby is given a 2 if a baby is pink all over, 1 if only the hands and feet are blue, and 0 if the baby is blue or pale all over. For pulse, we count the baby's heart rate through the umbilical cord or from auscultating the chest. Baby gets a 2 if heart rate is more than 100, 1 if less than 100, and a 0 if there is no pulse at all. In grimace, we observe the baby's response to stimulation. Baby gets a 2 if baby cries, 1 if baby only grimace, and 0 for no response to stimulation at all. For activity, we are assessing the baby's muscle tone. Baby gets a 2 for well-flexed limbs, 1 for some flexion only, and 0 if baby is flaccid. For respirations, we are assessing the baby's respiratory effort. We do this by looking at chest rise or by auscultating for breath sounds. Baby gets a 2 if baby has a strong cry, 1 if breathing is weak or irregular, and a 0 if baby is not breathing at all. We total the scores from each component and we get the Apgar score. The scoring is done at 1 minute after birth to assess the need of intervention such as resuscitation, then at 5 minutes to assess the response to resuscitation, then at 10 minutes, still to assess response to resuscitation and also neurological outcome.